This is called kneecap, that is patella. If this patella doesn't glide like this smoothly in the center of its groove and it comes out, slips out like this, that is called as patellar dislocation. If this patella slips out like this 3 or 4 times in a year or repeatedly happens upon sporting activity or any hyperflexion of the knee, then it is called as recurrent dislocation of patella. If it happens on each flexion, each moment of flexion, means every time person flex his knee or her knee, this comes out like this. It is called as habitual dislocation. So what are the causes of this recurrent or habitual dislocation of patella? Commonly we see recurrent dislocation that is seen in this adolescent age group of sporting people. The commonest cause is trauma. Trauma is an injury, that is when someone falls or someone hyperflex his knee during the sport and this comes out, and the ligament here inside is called as MPFL, that is medial patellofemoral ligament, that gets torn. Sometimes the ligament gets torn and sometimes the ligament gets avulsed, that is a part of the small broken piece of the bone is comes out with the ligament. Then that becomes a recurrent event, means because there is no support here, the ligament is not holding this kneecap to be in the center. This comes every time, many times. So that is one of the reasons. Second thing is anatomic factors, that some people have the knock knees. You would have seen someone's knee is like this knock knees. Knee comes pointing inside and the leg goes out. These knock knee people are at high risk of development of this recurrent dislocation of patella. Also something called as trochlea, this is called trochlea, that is the groove of the patella. On this groove, this patella has to track. If this groove is very shallow, that is sometimes from the birth or sometimes from the development, their groove is very shallow. Then whenever this patella comes like this, the tendency of this kneecap to come out because the groove is shallow. Sometimes this tibial tuberosity is very much lateral. We measure it something called as tibial tubercle trochlear groove distance, means this kneecap center and the center of this tibial tubercle, this is outwardly, it is present outward compared to the normal individuals. So then they will have higher tendency to develop into this recurrent dislocation of patella. How it is treated? The common treatment for initial phases, or if it happens first time, second time, is by the physiotherapy and exercise. In order to strengthen these muscles, we do some kind of strengthening exercises, or sometimes taping and sometimes braces are given. If it is first time or second time, if it recurs repeatedly, we will have to do MRI scanning to assess the integrity of this MPFL, assess the angle between this trochlear groove and the tibial tubercle, how much distance it is, and to assess the shallowness of this trochlea. If any of these things are there, then it has to be done, addressed with the surgical treatment. Surgical treatment is by the ligament, that is the medial patellofemoral ligament reconstruction in isolation, means only doing ligament reconstruction. If there are no other reasons are there for dislocation of the patella, if it is due to lateralized tibial tubercle, then it is something called Fulkerson osteotomy, where we are medializing the tibial tubercle and anteriorizing the tibial tubercle, that is this part of the bone is shifted medially so that the patella doesn't come out and slips out. And the third type of surgery is something called as trochleoplasty, where if the shallowness of the trochlea, the groove of the patella, where it slides is too much, then we will make it a deeper groove, that is called as trochleoplasty. These surgeries can be done in isolation, means either doing only such one of these procedures, or in combination, where if there are multiple reasons for dislocation, we will do multiple procedures to solve the issue of dislocation. That is called menu a la carte approach. Means a la carte means whatever the issue, whatever is the cause of the dislocation, to treat the cause. So we will have to evaluate properly. We will have to take the multiple views of the X-rays and MRI scanning and clinical examination then we will understand the reason for this recurrent dislocation of patella, and definitely the treatment, surgical treatment, is an excellent method to address these kind of issues. Along with the something called as lateral release of the structures, if it is tight, also can be done. So combination of these procedures will help in regaining the patella to its own track and to avoid or to prevent the dislocation of the patella. These procedures are really successful if the cause is properly addressed and analyzed and treated. Thank you for watching this video. If you have liked it, if it is useful to you, please like it, and don't forget to subscribe to my channel to see such orthopedic videos regarding the ligament surgeries, joint replacement surgeries, knee and shoulder surgeries. Thank you.